Have you ever felt like your body might be sending you signals, but you weren't sure what they meant? What if something as subtle as a persistent strange taste in your mouth could be a warning sign of a serious illness like cancer? It may sound surprising, but the truth is your body often gives you clues, and ignoring them could cost you precious time. Cancer, one of the most devastating diseases globally, doesn't always announce itself with obvious symptoms. In fact, some of its earliest warnings may appear through unexpected changes in your sense of taste. Think of these taste changes as your body's early alerts, whispering that something isn't quite right. Would you recognize them? In today's video, we'll uncover 8 cancer-related taste changes that many people overlook, signals that could be crucial for catching the disease in its early stages. This knowledge could save a life, so make sure you stay with us until the end. Let's dive in. You might wonder, how can cancer disrupt something as specific as taste? The answer lies in the way cancer alters your body's normal functions. Cancer can impact taste buds directly, change the way your brain processes sensory signals, or even release specific chemical compounds that affect your sense of taste. Furthermore, treatments like chemotherapy or radiation can intensify these effects, but often, taste changes occur before a diagnosis, serving as an early warning. Research shows that certain cancers, such as oral cancer, stomach cancer, and pancreatic cancer, produce unique metabolic byproducts that can lead to strange and persistent tastes in the mouth. Paying attention to these subtle changes might give you the early edge in identifying a problem. Let's explore these 8 cancer-related tastes, what they mean, and why they shouldn't be ignored. 1. Bitter or metallic taste, a clue to blood cancer. A persistent bitter or metallic taste in the mouth can be more than just a minor annoyance. It may serve as an important warning sign of blood cancers like leukemia or lymphoma. This taste often occurs due to changes in the composition of the blood as cancer interferes with the normal production and function of red and white blood cells. The disruption in these processes can lead to the release of excess iron or other chemical compounds into the bloodstream, which in turn affects how taste buds perceive flavors. This metallic or bitter taste tends to linger and is not easily remedied through brushing, rinsing, or changes in diet. Many individuals dismiss this unusual taste as a result of poor oral hygiene, dietary habits, or minor issues like dental product reactions. However, when the taste persists despite these interventions, it's essential to consider the possibility of an underlying health issue. Blood cancers often cause additional symptoms, such as unexplained fatigue, frequent infections, and significant weight loss, which can occur alongside the metallic taste. These signs should not be ignored, as they may indicate that cancer is affecting the body's blood and immune systems. If these symptoms appear together, it is crucial to consult a healthcare professional immediately. Early detection of blood cancers can significantly improve treatment outcomes, making it vital to pay attention to these subtle but potentially life-saving warning signs. 2. Sweet and fruity taste, a warning for lung cancer. A sweet and fruity taste in the mouth, while seemingly harmless, can be an unusual and early warning sign of lung cancer, one of the most silent and deadly forms of the disease. This distinct taste is caused by volatile organic compounds produced by cancer cells in the lungs. These compounds alter the body's metabolism and release byproducts that affect the sense of taste, creating a lingering sweetness that doesn't originate from food or beverages. Unlike normal sweet flavors, this taste is persistent and may not fade after meals, or with oral hygiene practices such as brushing or rinsing. What makes this symptom particularly concerning is its subtlety. Many people overlook it or attribute it to less serious issues like dietary choices or mild illnesses. However, if this unusual taste is accompanied by other symptoms, such as a persistent cough, difficulty breathing, hoarseness, or unexplained chest pain, it's a sign that immediate medical attention is necessary. These symptoms, combined with the fruity taste, could indicate lung cancer's progression. Early detection is critical, as lung cancer is often more treatable when caught in its initial stages. Paying attention to persistent changes in taste, particularly when coupled with respiratory issues, could make a life-saving difference. 3. Rotten or foul taste, oral or throat cancer. A persistent foul or rotten taste in the mouth can be an early warning sign of oral or throat cancer, often overlooked or mistaken for minor dental issues. This unpleasant taste typically arises from tissue necrosis, infections, or tumors within the oral or throat region, which release harmful compounds that alter the natural balance in the mouth. Unlike temporary bad breath or the effects of poor oral hygiene, this taste is persistent and may not improve with routine brushing, rinsing, or dietary changes. In addition to the foul taste, other symptoms often accompany oral or throat cancer, such as persistent sores in the mouth or throat, difficulty swallowing, unexplained hoarseness, or red or white patches in the mouth. These symptoms, while sometimes attributed to less serious conditions, should not be ignored if they persist. Early detection plays a critical role in the successful treatment of these cancers. Unfortunately, many individuals delay seeking medical attention, assuming the problem is related to common dental or throat issues. If you notice a foul or rotten taste in your mouth that doesn't resolve and is accompanied by these symptoms, it is essential to consult a specialist immediately. A timely evaluation by an otolaryngologist or oncologist can help identify the cause and potentially save your life. Recognizing and acting on these early warning signs could be the key to effective treatment and recovery. 4. Sour or acidic taste, stomach or esophageal cancer. A persistent sour or acidic taste in the mouth, while often dismissed as a common digestive issue, could be an early warning sign of stomach or esophageal cancer. This taste typically occurs when cancer disrupts the normal digestive process, causing acid reflux or other imbalances that push stomach acid into the esophagus. The result is a lingering acidic sensation that alters the taste in your mouth, which may persist even after using antacids or making dietary changes. Although occasional acid reflux is a common condition, a sour taste that doesn't improve with treatment or consistently reappears should not be overlooked. Other warning signs that may accompany this taste include difficulty swallowing, known as dysphagia, persistent nausea, unexplained abdominal pain, or unintended weight loss. These symptoms, especially when they appear together, could indicate a more serious underlying issue like stomach or esophageal cancer. Because these cancers are often diagnosed at advanced stages due to their subtle early symptoms, paying attention to persistent changes in taste and digestion is critical. If you experience a sour or acidic taste that does not resolve and is paired with any of the mentioned symptoms, it's vital to consult a gastroenterologist as soon as possible. Early diagnosis and intervention can significantly improve treatment outcomes, making it essential to recognize and act on these early signs. 5. Chemical or medicinal taste, pancreatic cancer. A chemical or medicinal taste in the mouth, often described as plastic-like or unusually artificial, can be an uncommon but significant warning sign of pancreatic cancer. This peculiar taste arises from the release of metabolic byproducts as the pancreas begins to malfunction, which can alter how the brain and taste buds perceive flavors. Unlike temporary taste changes caused by certain medications or foods, this sensation tends to persist and lacks an obvious explanation. Pancreatic cancer is known as a silent killer because it often develops without noticeable symptoms in its early stages. This makes subtle signs like a chemical or medicinal taste particularly important to recognize. Other warning signs may include jaundice, which is characterized by yellowing of the skin and eyes, persistent back pain, unexplained weight loss, or changes in digestion such as nausea or loss of appetite. These symptoms, when coupled with the odd taste, should prompt immediate medical evaluation. Because pancreatic cancer is frequently diagnosed at an advanced stage, early detection is crucial for improving treatment outcomes. If you experience a persistent chemical taste in your mouth, especially if it is accompanied by any of the mentioned symptoms, it is essential to consult a healthcare provider promptly. Paying attention to these seemingly minor changes could be the key to catching this disease early and significantly improving the chances of effective treatment. 6. Ammonia-like taste, kidney cancer. An ammonia-like taste in the mouth can be an unusual but significant warning sign of kidney cancer. This taste often occurs because kidney cancer impairs the kidney's ability to filter toxins and waste products effectively, leading to a buildup of urea and other chemical byproducts in the bloodstream. As these compounds accumulate, they can alter the body's internal chemistry, causing the persistent taste of ammonia in the mouth. While an ammonia-like taste can also result from less severe conditions such as severe dehydration or urinary tract infections, it is crucial to pay attention to additional symptoms that may indicate a more serious issue. Kidney cancer may also present with blood in the urine, persistent back or side pain, unexplained fatigue, and sudden weight loss. These symptoms, especially when combined with the unusual taste, warrant immediate medical attention. Kidney cancer is often diagnosed in later stages due to its subtle early warning signs, making it essential to recognize changes in taste or other bodily functions. If you notice a persistent ammonia taste that doesn't resolve with hydration or dietary changes along with any of the accompanying symptoms, consult a healthcare provider promptly. Early detection could significantly improve treatment outcomes and potentially save lives. 7. Salty taste, parotid or salivary gland cancer. A persistent salty taste in the mouth, particularly when it occurs without having consumed salty foods, can be an overlooked warning sign of issues with the salivary glands, including parotid gland cancer. This unusual taste sensation often results from disruptions in salivary gland function caused by tumors or other abnormalities. As the glands struggle to produce or regulate saliva effectively, changes in its composition can lead to the perception of a salty taste. This symptom is frequently accompanied by other signs, such as dry mouth, swelling or lumps near the jaw or under the ears, and difficulty swallowing. In some cases, there may also be persistent pain or facial numbness in the affected area. These symptoms, while seemingly minor, can point to underlying issues with the salivary glands that require further investigation. Because salivary gland cancers are relatively rare, this warning sign might be easily dismissed, or attributed to dehydration, dietary choices, or minor infections. However, early recognition of these symptoms is crucial, as timely diagnosis and treatment can significantly improve outcomes. 8. Bland or loss of taste, multiple cancers. A sudden and unexplained loss of taste, or the persistent sensation that all foods taste bland, can be an early warning sign of multiple types of cancer, including head, neck, and gastrointestinal cancers. This change often occurs when cancer disrupts the delicate nerve signals that connect the brain to the taste buds. In some cases, tumors or related metabolic changes can interfere with the way flavors are processed and perceived, leading to a diminished sense of taste or an inability to enjoy food as before. While temporary loss of taste is common during colds, sinus infections, or other minor illnesses, a persistent change without an obvious cause should raise concern. This symptom becomes even more significant when accompanied by other warning signs, such as unexplained weight loss, difficulty eating or swallowing, or persistent fatigue. These associated symptoms may indicate that cancer is affecting the body's ability to process nutrients, or maintain normal appetite and eating patterns. Because the loss of taste can be subtle or gradual, it is often overlooked or dismissed as a normal part of aging or the aftermath of a previous illness. However, when it persists and impacts daily life, it is crucial to seek medical attention.